Hello everybody, this is from Ampalaya Plus once again. On our previous video, we talked about the common symptoms of having type 2 diabetes. And in this episode, we'll be talking about the risk factors that you need to consider when thinking of getting tested. If you have these risk factors, it would be prudent to get tested right away. The first common risk factor is overweight or obese. The more fatty tissues you have, the more resistant your cells become to insulin. Have a family history of diabetes. If you have a parent or siblings that has type 2 diabetes, your risk in getting type 2 diabetes is higher. Age 45 or older. Your risk increases as you get older. This may be because you tend to exercise less, you lose muscle mass, and you gain weight as you get older. Have high blood pressure. Having blood pressure over 140/90 millimeters is linked to an increased risk of type 2 diabetes. Not physically active. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up your glucose as energy, and makes your cells more sensitive to insulin. Have a history of gestational diabetes. If you developed gestational diabetes when you were pregnant, your risk of having pre-diabetes and type 2 diabetes later increases. Have polycystic ovary syndrome or PCOS. For women having polycystic ovary syndrome or PCOS, a common condition is characterized by irregular menstrual periods, excess hair growth, and obesity. This increases the chance of getting type 2 diabetes. If you have 2 or 3 risk factors that we have mentioned before, we suggest you to see your doctor right away and allow yourself to get tested.